I'd like to ask you about patient safety and how patients can empower and educate themselves towards medical negligence, so to say, or asking questions from the doctors in today's day and age.
So, patient safety has been a big issue. I think there's a lot of work going on. 1 in 10 medical interventions have avoidable harm, and that's a pretty large number, and that could lead to fatalities and all kinds of issues. So there's a lot of work going on within hospitals on improving clinical excellence, ensuring that the diagnosis is right, and more tools are coming up. But in spite of that, there would be errors, and these errors are errors at every stage of the patient's journey. Patients have symptoms, but they don't land up. They keep ignoring, and they're saying it'll be all right. When they meet the doctor, they're not prepared, and the doctor has just 10 minutes, and in the process, the diagnosis goes wrong. Many of us miss the diagnostic test, or there are problems in it, and this story goes on. In all this, when we have a problem, we complain about the doctors and the hospital and move on to the next one. But actually, there's a lot that patients can do themselves to prevent this harm. And I think our job is to, I'm not using the word empower, is actually to create awareness so that they are very careful and they can prevent half the harm. They can actually help the doctors by cross-checking, by asking questions, by taking charge of their own journey. Very simple examples I gave you are on when we visit a doctor. Do we have a list of questions? Do we know our symptoms? Have we written them down? Have we organized our medical records in a manner that the doctor would not have to waste time to look at it? And so on. Now, if you do that, the chance of the right diagnosis gets better. We've just analyzed falls. There is so many people who fall and all kinds of issues happen. Falls in the hospital, we believe it's the nurse's job to prevent falls. But we as caregivers can be also preventing falls. Medication errors are all over the place. There are lots of look-alike, sound-alike medicines, and we are not careful, so we actually land up taking the wrong medicine. But there's so much ways to check the medicines ourselves. So what we are doing is to, in a simple manner, tell patients what to do while the healthcare people are doing what they do, and I think the response has been amazing. We are also been advocating to the hospitals to engage with patients, to ensure that patients are engaged in this. And I'm very happy to say that last month on the Patient Safety Day, we actually launched patient advisory councils. And if you do not give patients a seat on the table, just saying that we are involved doesn't help. So the Patient Advisory Council is where the healthcare provider, senior management, and bodies of patients are actually going to interact, talking about what's working, what's not working, what are their expectations. And I think this whole journey is what we are mapping now. So we do hope it's a big journey, and given India's own demographics, literacy levels, it's a long job, and we do think that all of us need to join our forces to get the message out. By the way, whether you are a healthcare provider or a nurse or a doctor, everyone is a patient, right? So you just have to wear their shoes and realize. So I think the requirement for a patient is that I get healthcare in time, it's effective, and it's safe, and I go back well. And I think in this journey, need for empathy is very high. So we have partnered actually with the nursing organizations to say, our expectations are these, and this is how we can help you, this is how you should help us. So this model is going to be working. I think we are excited that the healthcare providers have openly welcomed us as partners, and they said they don't see us, we're not getting into medical legal cases and so on. We are not going to be representing individual cases, but we will aggregate patient stories and take it back to hospitals for learnings. So this is our agenda, and we do hope all of us gain from this.
Right. Thank you so much, Mr. Mittal, for joining us here. It was lovely hearing your views.
Thank you.